we're going to use this x-ray as an example to talk about what our treatment options are for when we have bone-on-bone arthritis to the inside part of our knee, but the rest of the cartilage looks good. In the old days of orthopedics, not too long ago, what orthopedic surgeons used to tell people if you had arthritis just on one part of the knee was that we would give you shots or pills or something to try to cover the symptoms, and we would tell you to just wait as long as possible and just let the arthritis go through the whole knee. And when you couldn't take it anymore, we'd say something like, you'll know when you can't take it, and then come back, and then we'll do a thing called a total knee replacement, where we would replace the whole knee with something that looked a little bit like this. And it was a good operation, but certainly a big operation. And nowadays, frankly, we do things a little differently. Nowadays, if we have arthritis on the inside part of the knee, but the rest of our knee looks good, we do something called a robotic-assisted partial knee. A robotic-assisted partial knee starts off with a CAT scan, and we do a CAT scan of your leg to create a three-dimensional model of your individual bone on a computer screen. And then in my office, I can do a virtual operation where I replace just this very bone that lost its cartilage. And most importantly, we straighten your leg back to where it was when you were a teenager. And by doing that, it helps protect the cartilage in the rest of the knee from developing arthritis. Once I have it perfect on the virtual model, on the virtual surgery, we can download that to a robotic arm that we can use to translate it off the virtual world into real life. And it ends up looking something a little bit like this. And this piece caps in on the part of the femur, and then there's a part that goes on the shin bone of the tibia. And then that allows you to have two nice smooth surfaces to let the knee bend and glide. The advantages of that over the old-fashioned total knee are basically three. One, it hurts less to have done. We tell people it's not a walk in the park. It's still real surgery and real recovery, but people that have had an old-fashioned total knee and one of the new robotic partial knees say the partial knee was quicker recovery and had less pain with it. The second key, and frankly the one that makes a big difference to everybody, is we have a much higher chance when we're all said and done of you coming back and saying, it feels like my own native knee. And that's what we're after, a knee that moves and feels as close to your own knee as possible. The third one, the risks of surgery with the total knee that you may have heard of, those are things like blood clots, heart problems, lung problems, or infections. Those things are much, much, much less with the partial knee, and so it's a safer procedure. Recovery time frame wise, if we're ever thinking about having that done, what does that look like? It's outpatient surgery. People go home the same day. You can put all your weight on it right off the bat. So we start out with a walker, and you can get rid of it as soon as you feel comfortable. After a few weeks, most people feel good to drive. At 3 months, we let people do sporting activities like tennis, golf, skiing, those sorts of things. The full end date for most people is around 6 months. And at 6 months, that's when people kind of mentally say they sort of feel fully recovered. The chances that you say it feels like your own knee at that time are around 94%. The old-fashioned total knees, only about 70% of people ever said they felt satisfied enough to kind of feel that way. Longevity-wise, there were some partial knees done that are put in without the robots, and they don't actually straighten your leg. And those were kind of stepping stones to total knees, things that had to be revised to total knees a few years down the road. This is not that. We don't do that style of knee and never have. When we do a robotic partial knee, we intend it to be the last knee surgery you're ever going to need. And the data shows that 92% of people need no other knee surgery for 20 years. It's a lot of information. Feel free to rewatch this video. If you have any questions at all, feel free to reach out and talk to me. Otherwise, my staff will be connecting with you to talk next steps, and I hope you're doing well.